people here at Oriental Clinic often comment and say, wow, that's really great. You have the Western medical background and the skills of Oriental medicine, so you have the best of both worlds and bring them together. That's the best we can have. And look, that sounds good, but one has to really have a look closer to it, because we have on the one hand the Western medical system and on the other hand the Oriental medical system. And how actually can we bring them together? What makes them different and what makes them similar? And the other day I had this conversation with a colleague of mine, and and there were quite a few fruitful points that I would like to discuss with you. So first of all, let's have a look at the Western medical doctor. And if you think of an old-fashioned good doctor, you think of a doctor who first of all takes time for the patient and listens very well, and I guess that's essential to become good. But then you also learn 4 essential skills in medical schools that are based on your subjectivity. So these 4 skills are looking, listening with a stethoscope mainly, touching, which is touching the belly or other parts of the body to find out about the dysfunction. And the last one is percussion, which is actually tapping with your fingers on certain body parts to find out what's wrong. A lot of doctors do that, for example, on the back to listen to the lungs. And so those 4 skills are essential to get a good idea as to where the patient's condition is. And once this is established, then the doctor will go further and might order some blood tests or other scans to delve deeper into the situation. Now, the point I want to make is this, that a good GP, in order to be good, has to first be skilled in his or her senses and then hone into their experience to find out the most out of their senses. So that's the GP. Now, when you look at the Oriental medical practitioner, it is actually not dissimilar at all. The Oriental medical practitioner also has to hone into their senses. And as a matter of fact, the 4 skills that I just mentioned are the same, except for the listening part. The doctor listens with a stethoscope. The Oriental medical practitioner listens just with their ears. They don't have a stethoscope. And what they listen for is primarily the voice of a person. Is the voice loud? Is the voice low? What is the demeanor of the person when he comes in and talks? And all these aspects are taken into account when a diagnosis is formed. And in Oriental medicine, you have a very intricate system of pulse, tongue, and abdominal diagnosis. And they are all relying on your subjective skills. So these days, subjectivity kind of is a dirty word. It's put into this category of one can't rely on it because it's subjective. But as a matter of fact, when you learn subjective skills in a reproducible way and then combine it with experience, it is a very reliable tool in order to find out more about the body's condition. And in that way, seriously, a GP and an Oriental medical practitioner, they are really not that far apart in basics. Of course, they look for different things, but they both rely on those subjective skills that they learn in medical school or in Oriental medical school, really. And then the rest is, of course, different, like the scanning and the blood tests in the Western world. And I mean, I get that. It is an important part of Western medical, of Western medicine to have these objective measurements in order to find out more about the person. But from a functional perspective, they both have to first rely on those subjective skills. An Oriental practitioner can learn to feel what certain qualities, impulses may indicate for certain bodily functions, and we can see, feel, palpate the changes in the body resulting from inserting a needle in an acupuncture point. And then some people say there is no evidence for meridians and acupuncture points, they are not objective because they can't be seen and they can't be found. Likewise, you can't find lines of longitude and latitude, north and south, or you can't even find time. However, we can use these things to navigate and fly people across the Pacific reliably, reproducibly, and predictably. So, when I go back to the question at the beginning, what are the similarities and what are the differences between both systems or between both practitioners, I can say in a nutshell, when it comes to their essential qualities, a GP and an Oriental medical practitioner have to almost have very similar skills. They differ in other ways, and that's more in Western medicine. You have, of course, the whole external measurement side of things, which are the external tests, the scans, the blood tests, etc. And sometimes it is very necessary that a person has to go that route in order to find out about their dysfunction. On the other hand, in Oriental medicine, beside the subjective skills that both have in common, you have more the holistic view on things, and that includes the whole aspect of lifestyle medicine and environment, which nurtures the individual that is sick or unwell. And I mean, Western medicine is catching on to that, but Eastern medicine has had that for 2,000 years in their program. So when we bring both together, we have to really look into all the aspects that are important for that person. And when you have both the Western medical background as well as the Eastern medical expertise or knowledge, then hopefully you can actually tailor a program at best for the patient. Now, this is the end of our discussion, which hopefully was interesting for you and gives you a little bit food for thought. And it would be most helpful and interesting for us if you put some comments below what your thoughts are, whether you have any questions. And depending on that, we will, or we might actually look into that a little bit further. Thank you so much for listening.